Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue Salt Therapy Part 21 Calorimeter. Full name Kalium muriaticum. Chemical name Potassium chloride. Mode of action. How does Calorimeter work? Mixed with oxygen and albumin, Calorimeter produces blood protein FIBRIN. If there is want of Calorimeter in human body, FIBRIN tends to come out of the system or gets locked up in a place of the system. System means your body. This salt is present in nerves, muscles and many other tissues of our body. When some body fluid including blood comes out of our system and coagulate partly in the remaining fluid part, the salt remains. Albumin plus oxygen plus Calorimeter, this three produces FIBRIN. How does Calorimeter work? It's continuing. In fluid created out of inflammation, FIBRIN remains. The whitish or greyish matter, viscid, sticky like thread or flour, which sometimes accumulate on tongue, mucous membrane, skin, tonsils, etc., is indicative of want of Calorimeter in our body. So, through natural or unnatural openings of our body, when whitish, sticky, thread-like substance is excreted due to some disease condition, Calorimeter cures it. This exudate may be cold, that is snivel, stool, urine, or other wounds or ulcer. I mean, exudates from these wounds or ulcers. Now, just the images. This is the typical tongue of Calorimeter. Typical tongue of Calorimeter, white coating. This is tonsils are covered with whitish exudate. The child has got a tremendous sniffles coming out of his nose and mouth, and these are ulcers oozing out yellowish white exudate. Calorimeter for head and scalp symptoms. Headache with thick white coating on tongue, that is characteristic symptom of Calorimeter. White cold from nose or mouth, vomiting of white flame, hawking of thick white mucus, old chronic headache due to constipation from sluggish action of liver. In meningitis, when effusion has already started, effusion means actually accumulation of fluid in the layer. Meningitis, actually meninges layers. There are layers of dura mater, arachnoid matter, and pia mater in the brain. Within this brain, that layer space, fluid accumulates. It's called meningitis. And when meningitis, fluid accumulates. Just started, that stage is fit for Calorimeter. Just after the first stage of inflammation. First stage, Ferramphos. Just first stage is going to second stage. Effusion is starting, this Calorimeter. And the most important thing, mind is Calorimeter is always something white. White on tongue, white cold nose, mouth, vomiting of white flame, hawking of thick white mucus. Everything is old, white and albuminous. Calorimeter for eye symptoms. Discharge of white mucus, same thing. Yellow greenish matter or purulent yellow scab or yellow scab. 1. Look at the picture of the eyes of the child. This is number 2. Feeling of sand in eyes, iritis, blisters on cornea, cataract after calcarea fluor. That is, after calcarea fluor, Calorimeter comes. Calcarea fluor also used in this phases. That is, blister on cornea, cataract, but sometimes it may not give the required result. Then Calorimeter comes. Trachoma. Trachoma is a technical term. Eruption on the inner surface of the iris. Note this here. inner surface of the, this is the inner surface of the eyelids. There are some eruptions, that is called trachoma, with dirty yellow discharge. From here, dirty yellow discharge comes out. Hypopion, number 3, hypopion. Hypopion is accumulation of inflammatory fluid in the anterior chamber of eye. The chamber that situated just in front of the lens, that is anterior chamber. Posterior chamber, there is another posterior chamber behind the lens. It is anterior chamber accumulation of fluid, hypopion. If it may look that this disease, this is a serious disease. Can it be cured by tissue salt? Yes, it is curable. Keratitis is inflammation of the cornea. Here, cornea inflammation is slightly, the eye looks reddish. The symptoms of green here, main symptoms of keratitis. Keratitis is much more severe than ordinary conjunctivitis. Mind it, keratitis means inflammation of cornea. Cornea is the most important part of the eye. Without a good cornea, man cannot see anything. So this main symptom of keratitis: red eyes, profuse tearing, photophobia, that is, he cannot tolerate light. Corneal clouding, cornea becomes clouded, and intense pain. This is the picture of retina, that is retinitis, number 5. Retinitis, there is retinitis. Retina is inflamed, retinitis, and you cannot see by open eyes. You have to see this thing through ophthalmoscope. This is ophthalmoscope instrument. Through this ophthalmoscope, this view is available. This is white spots are showing this inflammatory signs. Calorimeter for ear problems. With white or grey-white coating on tongue, swelling of glands about ears and earache. Earache with swelling of tonsils and Eustachian canal. 1. Picture 1. This one means picture 1. Look at this picture. This is the picture of ear. Anatomy of ear here is. From this is the tympanic membrane. From here up to this external ear, this is first part of the ear. This is the second part of the ear, and this is the third part or last part. In the second part, there is 3 small bone. You know this, malleus incustapis, and a tube called Eustachian canal, which connects the middle ear with the throat. With this channel, this tympanic membrane maintains air pressure on both sides. From here outside, through ear drum, air is coming, and from throat, air is coming. Air is coming from this way, and air is coming from this way. For that reasons, the tympanic membrane is working nicely. Various subjective sounds in the ear. Subjective sound means the sound which are listened by the subject himself, that is patient himself. Anybody near him cannot listen to their sound. The sound are felt by him. This is actually some nerve trouble in the nervous system of the ear. Ear. Nervous system of the ear of the person. So he or she can only listen to these subjective symptoms. Hard of hearing due to otitis media. Otitis means inflammation of ear. Media means middle ear inflammation. Or interna. Interna means internal ear. Or throat affection. All this covered by pharynx. And that subjective symptom of the ear also in the pharynx. Cracking sound in the ear during swallowing or cleaning of nose. Thick pus exudation from ear. Sometimes from this ear, this is canal ear, this external ear, and this is eardrum. This from eardrum, thick pus comes out. This is also covered by Calorimeter. Now other pictures. This is tympanic membrane, normal tympanic membrane. This is affected, that is infected or inflamed tympanic membrane. If this inflammation continuous goes on and on, there may be perforation. Otoscope is the instrument using by the doctors to see the internal structures of the ear, and these are very fine instruments of internal ears and other cleaning of ears, instrument for cleaning of ear, etc. life case. A child of 8 years had been suffering from whooping cough for last 1 week. Recently, cough was so intensified that it used to run about the room during a paroxysm. It appeared that there would be cessation of respiration. On examination, it was seen that tongue was covered with white coating. It was also gathered a little whitish mucus come out after cough. Ferrampos 3-6, Calimure 6-6 was prescribed in 1 gram dose to repeat after every 10 minutes alternately. Afterwards, with lessening of severity, time was to increase gradually 20 minutes, 40 minutes, etc. Next day, it was reported that after 6 doses, the child went into deep sleep and that night there was no attack. It took about 2 weeks time to get it complete cure. Please note that most cases of tissue salt therapy started with 6x potency. However, 3x potency of ferrampos, calimure, and magnesia phos are also very efficacious. Please read TST part 1 to 6 introductory parts for details regarding dose, potency, repetition in tissue salt therapy.